Good afternoon. This is Joel Ainsworth from ECONorthwest, and I'm joined by my colleague, Andrew Dyke.
Hello.
Today, we're going to be talking a little bit about the work we've been doing for the Oregon Health Authority around the excessive or the economic burden of excessive alcohol use in Oregon. So the work that we have done and are currently doing for OHA really consists of three main pieces. The first piece is just an overall literature review, kind of looking at the current state of the economic and social science literature, focusing on these components of measuring economic burden to see what's changed, what's the types of reports that are out there, looking at the efficacy of alcohol tax policies, and then really framing a policy scenario for them that will ultimately feed into their policy work and potentially a legislative package that they would put together around alcohol pricing strategies. So before we get into our analysis, I just wanted to provide a couple of slides to give some context as to why we're doing this work. And I think the first and foremost reason as to why we're doing this work is that Oregonians consume a lot of alcohol. And so if we look at the slide here that I'm currently showing, this gray bar that's horizontal represents the US average consumption of gallons per capita between 1970 and about 2019 or so. And this blue line that we see is consumption relative to the average. And so if we look at Oregon historically and certainly in the recent trend, what we see is that it's more often than not that Oregonians consume higher per capita consumption than the US average. And certainly as we get into the 1990s and further into the 2000s, we see a deviation and a growth movement away from the average as that consumption per capita climbs in Oregon. And right now, the difference between the US average and Oregon is about 3.4 gallons per capita. Really, I think growing out of the explosion that we've had in microbreweries, wineries, and more recently distilleries, that's just sort of created an access to different types of alcoholic beverages that up until recently haven't been available in other parts of the United States. But another component of this is to really understand how these harms are distributed. And one way to look at this is across subpopulations. And what this chart shows is alcohol-related deaths in Oregon by subpopulation. As we can see, there's certain racial and ethnic groups where alcohol-related mortality tends to be more concentrated, specifically the AIAN population, whites and African Americans. And this chart is per 100,000 adjusted for age. The one caveat I would say with this particular chart is that there are a lot of data issues, classification issues on death certificates as it relates to AIAN population. And so although we do think that some of the harm is, the mortality is concentrated in that population, we do need to be mindful that there are some real issues with the underlying data that we need to just keep in mind as we interpret this chart. Additionally, and this chart's a little messy, but additionally, the harm is not evenly dispersed or evenly represented around the state. And what we see is that when you adjust for age, that rural areas in Oregon tend to have higher rates of alcohol-related mortality than the urban areas. And specifically Harney County, Southwest Washington, Klamath County, some of these areas where you see elevated rates of alcohol harms related to or compared to some of the urban cores in the Willamette Valley. So this brings us to our work, which starts by measuring the economic burden of alcohol abuse or excessive alcohol use in Oregon. And so when we go through the literature, we look at the prevalence and specific counts of incidents, look at the per unit costs for 2019, we come up with a number that's around 4.8 billion, which is a very large number, I think, as we all know. So to put some of this into context, $4.8 billion is the revenue of some pretty well-known companies in 2019, Delta Airlines, Airbnb, American Express. So really, it's one way to think about it is it's the value of the revenue for some pretty large firms. But to bring this back to Oregon, which is helpful for me to put this number into context, is that $4.8 billion is pretty close to the entire value of the economy of Corvallis. And so this is just a one-year number, right? So when we talk about $4.8 billion in economic burden, we're essentially talking about something close to the total economic value of Corvallis, the university, HP, the federal government and state governments, all of the functions that are out there year after year after year. One of the reasons that economists are interested in the harm of excessive alcohol use is, one, as we just mentioned, it's a really large number, but it's also how that cost is distributed across society. And so at a high level, we sort of put this into two different buckets. There's the private cost, which is about 46% of the total cost of economic harms. And that's really the cost imposed on, the private cost essentially imposed on individuals through lost earnings, or costs imposed on employers through lost revenues. So we kind of frame this as labor productivity, but really talking about reduced and lost earnings for those individuals that are either users or experience some type of harm that affects their employment. The other piece that is somewhat unique to alcohol is the large public costs. And part of this is simply due to all of the different aspects that excessive alcohol use touches in our society. Everything from criminal justice to healthcare, health and human services. It just really reaches a broad facet of our state and is sort of represented through our state's expenditures. And so this public cost really is the cost imposed on all of us as Oregonians that is directly attributable to excessive alcohol use. And maybe to put this public cost into context, often we use a lot of different jargon, but we'll sort of frame it as externalities or really as costs imposed on other people. But the research typically tends to narrow that focus. And this survey here, I think, provides useful context for thinking about how those different harms might sort of affect people that aren't users themselves, whether that is being in a passenger with somebody that's drinking or some other type of risky behavior, being assaulted, or family or financial problems. And so these are certainly important and embedded in the work that we've done. But for this analysis, we've taken a slightly broader approach. It's kind of a cost accounting approach where, again, we sort of look at the costs represented through agency expenditures. And there's benefits and costs to this. On the benefit of that is that we're really trying to get at what's actually spent on harms related to excessive alcohol use. There are some limitations that we'll talk about a little bit later on. The other reason that we care about this public component of the economic burden of excessive use is how those harms are distributed across our society. And again, we talked about this a little bit through the mortality piece, that it's not equally distributed across race and ethnicities, and it's not equally distributed across geography. And what the research tends to show is that alcohol harms tend to fall disproportionately on individuals who experience low socioeconomic status. And there's a variety of indicators that we pull in here, some which may be seemingly unrelated to excessive alcohol use, but may have some contributing factor as to why somebody may choose to drink in excess or may experience a disproportionate share of harms. And the four characteristics, or the four contributors that we list here, although it's broader than that, are really limited employment, housing instability, access to healthcare, which can sort of mitigate some of those harms related to alcohol use, and then the social networks, which can be a contributing factor to drink, or may be a contributing factor to experiencing a disproportionate share of harm relative to the average. So kind of bringing this back to our work, again, we find that the total cost, public-private cost combined, is about 4.8 billion in 2019. So that, when we sort of compare that to Oregon's economy, to sort of the total value of all of our goods and services produced within the state, that's about 2% of our GDP in 2019. So if we look over to the right side of the screen here, we see that this kind of cuts across several different social and economic structures. And this labor productivity piece at the top really is that, again, that private cost to individuals. But then we've got almost 30% of the cost comes from criminal justice and motor vehicle crashes, incarcerating individuals for offenses, victimization. And we've got healthcare, that's about 15% of the cost, and that tends to be related to the chronic care, although there is some measurable costs of acute care that's embedded in that. And then education and treatment, and then the social welfare. And social welfare, again, is a broad category, but we're really, in this case, in this context, primarily talking about costs related to health and human services provided to either users themselves or victims of excessive use. So as we were trying to think about how we tell this story about the disproportionate harms, there were a lot of categories that were really hard to disaggregate by race, ethnicity, by geography, by all of those. Mortality, we could. Criminal justice, healthcare, some of those others, we really just had a hard time doing that. But as we were sort of exploring this, one of the things that did pop out to us was that in these subcategories of costs that are embedded in the slide that I showed you before, we do have these very real measurable costs that are imposed on victims. And so as we were sort of looking through our different categories of economic costs, what we found is that about 1/3, $1.6 billion of the economic burden are costs imposed on victims. And though there is some likelihood that there's some overlap here between users and victims for property damage and fire, we really think that the overwhelming majority of these costs are imposed on people who may not be users themselves, but are victims of excessive alcohol use. So before moving on, we have to do the obligatory caveats. The first one, which I think is important, is that this is just a static view, or it's a snapshot of economic costs of alcohol in just 1 year. And of course, this is kind of a stock versus flow question, right? And really what we care about from a planning purpose is the life cycle costs of the individuals as their drinking patterns change over time, and their costs are likely to interact with different facets of the state's agencies or public health infrastructure as they move through their life. So this is an undercount in some respects, in that we're only looking at 1 year, but it's I think it's an important baseline to build off of. The second, because we're not looking at that narrow subset of externalities that I provided in that table, we're looking at agency budgets and their share of costs that go to alcohol-related harms. We need to be mindful that as we see those harms go up, it may not be a sign of inefficient spending. And what I mean by that is that if we choose as Oregonians to invest in things like healthcare or increase investment in mental health or treatment services, that may not be a bad thing. Even if we sort of redo this number 2 years from now and it's 5 billion, that number could be a sign of increased investment, which could actually be a benefit. And so we need to both look at the total cost and ultimately go back and look at the prevalence rates as well to make sure that those are moving in the right direction relative to the costs. And I think the third piece here, which is also important, is that there is a lot here that we can't measure. And we want to be mindful that those costs, some of which just can't be measured with our methodology, are important and should be considered as we, think broadly about the total economic burden. Some of those might be, family financial matters or other things. It's just that didn't show up in the data that we have available to us. So that data stopped in 2019. So before we move into the next section, I think we just wanted to talk a little bit about where we are and where we think we might be going. Heading into 2019 compared to recent years, we did see a pretty big jump there in the share of Oregonians that said they were binge drinking. And of course, we can't forget 2020, which was pretty traumatic for Oregonians everywhere, from politics, wildfire, and of course the COVID lockdowns, the deaths, everything that came with the traumatic experiences of 2020. And of course, heading into 2021, what we see is that from a high level economic indicators perspective, we do see some positive signs to the extent that the economy was a contributing factor. We see evidence that we seem to be coming out of the pretty severe but short recession that we had. Some of the leading indicators that we had been using to sort of track different measures of risk and health related to alcohol consumption and other indicators that we use in our work do seem to be sort of coming back down to baseline. They're certainly down off their peak. They're elevated from where they were prior to COVID, but they seem to be trending in the right direction. So employment, housing instability, and mental health seem to be moving in the right direction. So these are all really good things coming out of 2020 and sort of midway into 2021 now. I think for us, some of the remaining concerns that we have is because of some of those experiences, pretty extreme experiences, I think for a lot of people, that led to some pretty extreme changes in behavior. And some of this is related to policy decisions about increasing alcohol access on premise versus off premise. But really, we see this big divergence in sort of, risky drinking behavior that started in 2021 or 2020 and seems to be persisting into 2021, although we're still waiting for some of the data to come out. I think for us looking ahead, I think to the extent that this behavior remains well anchored in the Oregonian population, we just need to be mindful that although we do see some positive signs heading further into 2021, that we may still expect to see some need for greater mental health treatment services as some of this heavier drinking behavior persists. And so with that, I'm going to hand it off to my colleague, Andrew Dyke.
Yep, thanks, Joel. So this last section, the last slides we'll talk you through here is really based on our analysis of alcohol excise taxes specifically. And so we can go to the next slide, please. So just a little bit of policy context, or is what we're trying to do with this, is not provide a definitive answer to how all possible interventions that affect price or access to alcohol might affect the various things you see on the right, but to look at a very specific the effects of a very specific method for increasing the price of alcohol, and that is through the Oregon excise taxes on beer and wine. So we did look at the effect of changing these prices based on the literature. What we did not do is an analysis of all possible, interventions that might increase prices, such as minimum unit pricing, or all possible interventions that affect access, or importantly, the impact of programming that might mitigate the harms of excessive alcohol consumption, or educate and prevent alcohol consumption in the first place. So we're looking at an increase in excise taxes, and we looked at three different things. One, tax revenues, how they would be affected by an increase in excise taxes. Based on the literature, what might the effect on consumption be as a result of these tax increases? And then finally, taking those changes in consumption into mind, how might the tax increase affect the harms imposed by alcohol on the economy and on society more generally? Here's the context: alcohol taxes in Oregon. A couple of comments. Again, we're looking at Oregon's excise taxes. It's not all of the taxes that you're paying when you buy alcohol, whether it's beer, wine, or spirit. There's a federal excise tax. In other states, you will find sales taxes, et cetera. We're focused very much on the excise tax. What this chart's showing is a couple of things. One is that these taxes vary pretty dramatically across different beverage types. These numbers are all based on a standard drink that's 12 ounces of beer at about a 5% alcohol by volume, 5 ounces of wine at 12 to 13% alcohol by volume, and for spirits, 1.6 ounces of 40% alcohol spirits in a mixed drink or straight. And you can see that wide variation in excise taxes. For beer, Oregon's tax is less than a penny per drink. That's 45th from the top in terms of states. Tax on wine is a little bit higher at 3 cents per drink, putting Oregon about in the middle of the pack of states. And then a much, much higher 26 cents per drink based on spirits, and that's second in the United States. And you'll note the equivalent word there in italics, and that's because Oregon does not explicitly impose an excise tax on spirits, but through the Oregon Liquor Control Commission and the state-controlled liquor stores, the state effectively sets prices, which implies a certain level of taxes, and that's what that 26 cents per drink comes from. So what we did with our analysis, and this is still draft, but was to impose a specific tax increase on beer and wine. And what we did is we said, well, what would happen to prices, consumption, revenue, et cetera, if we increase those two excise taxes to the level of the federal excise tax? And in both cases, for beer and wine, the federal tax is higher than the Oregon state tax. And what that works out to is, in percentage terms, a pretty big increase. The increase in the tax on beer would be about 600%, for wine about 60%. But there's more to the price of beer and wine than taxes, obviously. So in terms of price increases, it's about 4% increase in prices for beer, 3% for wine, but a very large tax increase in percentage terms. And next slide, please. Okay, so what does the evidence say? We're not going to try to explain this picture to you. This is what you get if you ask an economist a question. More likely than not, you're going to end up with a picture with all kinds of lines and arrows moving around. We didn't want to drag you through the econometric weeds of the studies and the various estimates that we're relying on, but instead really focus on the high-level conclusions we're drawing from our review of evidence, all the work that went into the cost estimates that Joel walked you through, and come up with some qualitative statements for the most part about how that increase in excise taxes would affect the various outcomes that we're looking at. So to get to the meat of that, the next slide. First point here, largely about the effect on tax revenues. What the literature has shown consistently over a long period of time, numerous studies, is that consumers are relatively insensitive to price changes. Now, if you're interested in raising revenue, that's a good thing. You impose a tax on beer and wine, and if consumption doesn't change a whole lot, you raise a lot of money. It's unfortunately less useful for nudging behavior, which comes into play in the next few slides. But by and large, consumers are relatively insensitive to price changes. So based on this insensitivity, we can estimate the tax revenue derived from that increase in excise taxes, increasing those taxes to roughly a nickel per standard drink, only 4 cents for wine. But that tax increase would raise about $50 million per year in recent years. And because of that small behavioral response, it's pretty clear that alcohol taxes can provide a stable revenue source, although it's important to recognize that consumption is cyclical and tends to move in predictable directions in response to economic conditions and other factors that we can see and that Joel alluded to. In addition, any tax should be tied to inflation to stabilize revenues. That nickel a drink for beer 20 years from now is going to be a lot less impressive in terms of the behavioral response and in terms of revenue generated than a tax that's indexed to inflation. Next slide, please. So I think we're kind of unfolding these and giving away the next slide in the prior slide. Want to look at the effect on consumption in this case. Here, we're using similar literature and the same sets of data. Our current draft estimates suggest that increasing the beer and wine excise taxes to very roughly a nickel per standard drink, 4 cents per wine, would reduce drinking by about 4 drinks per capita. That's about 0.9% on an annual basis. Not a huge change. In addition, it's important to recognize that there are some pretty significant differential effects across subgroups of alcohol consumers. And in particular, the research tends to show time after time that changes in price, and that's what a tax increase does, it does not appear to affect risky drinking behaviors, binge drinking, excessive consumption over a long period of time, drinking while pregnant, etc. It's a different kind of effect. And even more importantly, perhaps, for thinking about the effects on harms that we'll get to in a minute, recent studies show that substitution effects across beverages may offset the intended consumption effects of targeted tax increases. For example, if we were to increase the tax on beer and wine, a predictable and expected outcome would be an increase in consumption of spirits. Now, again, from a revenue perspective, that might be considered a good thing. You're increasing sales at the LCC stores, increasing state revenue through that avenue. But from a behavioral perspective, it's less impactful. And in addition, even if we have a general increase in alcohol prices, the effect on consumption might not be what we would expect, because consumers have proven very willing to substitute sort of down the quality ladder, in that as prices go up, rather than drinking less, they tend to drink lower quality or less expensive products. Next slide, please. So here's just an illustration of how that plays out. What you're looking at is a chart that plots the price sensitivity of consumers by their intensity of drinking behavior. Lower intensity consumers of less alcohol are on the left. Higher intensity drinkers are on the right. And note that it's really those right-hand groups, the top 10%, the top 5% of drinkers, that we're most concerned about in terms of the economic harms. Most of those harms are imposed by the heaviest drinkers. And as you can see from the chart, the price sensitivity is quite a bit less for those groups than the consumers at a lower intensity that are less problematic from an economic harms perspective. And the next slide. And I think, again, I've given away my punchline, but our conclusion based on the preceding analysis is that in terms of the effect on social costs, price increases alone are unlikely to drive large reductions in alcohol-related social harms, even if we were to impose a broad-based increase in alcohol prices by taxing beer, wine, and spirits. But we just looked at the chart, and research suggests in other contexts is that most of the harm imposed by alcohol is due to the risky behaviors that are largely unaffected by prices alone. In addition, there are structural social issues that affect the harms related to access to healthcare, et cetera, that affect the harms that are not going to be dramatically affected by increases in price. So that's not to say that tax policy is unimportant. We do see tax policy as an important tool for a comprehensive harm reduction framework, but it's not a replacement for other interventions in a more comprehensive approach to reducing alcohol harms. And next slide. So what are the conclusions we draw from this? As you saw earlier, Oregon's alcohol excise taxes and thereby total taxes on alcohol are low relative to the social cost of consumption and relative to those in other states. So increasing taxes would better align Oregon's beer and wine tax policy with the implied tax policy for spirits, align Oregon's tax policy better with that in other states, and align the costs of consumption better with, the direct financial cost of consumption in terms of price with the social costs of consumption more broadly. As we saw also in the preceding slides, higher is not necessarily always better, particularly for targeted tax increases. We would expect substitution effects and avoidance behavior methods for avoiding paying increased taxes, driving across the river to Vancouver, for example, will increase as prices go up. And the bottom line there that I've said several times is that we would expect relatively small changes in consumption as a result, particularly to targeted tax increases, but also to more general increases in taxes. Finally, last point here, tax structure does matter. We've talked about a very specific change in taxes. Other types of taxes, such as location-based taxes, taxes specific to ethanol content, minimum unit pricing, such as the policies that OLCC has recently implemented, might better target that high-risk behavior that does drive a large share of the economic harm caused by excessive alcohol consumption. And so I think bottom line there is that it's important to consider a comprehensive framework, as we said in the prior slide, for reducing harms, rather than focusing too much on a single policy intervention. And with that, we'll close the slides.